There we are. Hello, everyone. Happy New Year. And we are live and getting this thing started off great for you guys. Before we get into it, because again, I always am excited. I'm always excited about what I'm going to talk to you guys about, but then I'm also extra excited about the guests that I have because all the people that I have are people that are near and dear to me and people that I love and respect. And I know that they're going to give us some great information. But before I get into that and talk about our guests and talk about what we're going to do today, you know that I am currently obsessed with the weather. So I'll tell you guys a quick story. I'm home for the holidays and I was talking to my dad and I said, well, we'll probably come in on Friday. Even though I knew that the weather is starting to look a little bad on Friday, so I think we can make it Friday. And he says, you need to come on Thursday. And I was like, well, I don't know. He was like, no, you guys need to get here Thursday. Well, he was right. I don't know. There's something about him and the weather because as soon as we pulled into his driveway, the snow started. Actually, it started about 10 minutes before, and even a little bit, it actually may have been, we started to see like rain and stuff in Memphis. So, Trey, you know about Memphis, all of that. So, that Memphis holds a special place in my heart because I grew up right next door to it, like 45 minutes away. So, we were there in Memphis and we started to see a little drizzle, a little rain. So, no big deal. But then as we got closer to home, the snow started to fall like soon as we pulled into the driveway. Of course, my kids were excited because my oldest was like, I want snow. I haven't seen snow. I was like, no, you actually saw snow when you were like 2 and 3. And she was like, I don't remember it, so it doesn't count.
Yeah.
I was like, okay. But now they're here in Savannah is doing something. It's like I guess 50s, 60s, and I'm trying to figure out like what to wear and what to do because it'll peak up and then you're like, oh, it's really nice, and then it'll drop back down and get a little cool. So, how are you enjoying the weather, Dr. Ochsner? Tell me about your weather story.
Yeah, it's Savannah. If you don't like the weather, go outside and wait 15 minutes and it'll be different. So, but we don't get snow around here except I feel like every 2 or 3 years. And then it'll
No.
stick for about 10 minutes and then go away. So I don't mind it right now. It's dry, which I like. I don't like getting rained on.
Right. I don't either. You're right. I like that. I'm gonna have to tell someone else that I'm like, yeah, every 15 minutes, just go out and you're gonna see something different. I love it. Well, guys, I don't want to hold you today because we want to go ahead and get into it. This is episode 9, warm-ups, workouts, and weights, how to prevent injuries from an orthopedist perspective. Today we have joining us Dr. M. Gage Trey Ochsner, who is a practicing orthopedic surgeon with Chatham Orthopedics here in Savannah, Georgia. He's a Savannah native who specializes in sports medicine and general orthopedics. He completed his orthopedic residency at the University of Tennessee Campbell Clinic in Memphis and his fellowship in orthopedic sports medicine at Andrews Sports Medicine and Orthopedic Institute in Birmingham, Alabama. He has managed the care of multiple high school, collegiate, and professional teams in various fields with treating athletic related injuries. But outside of medicine, Dr. Ochsner has many interests. He enjoys football and hunting, fly fishing, all the outdoor activities, you name it, he pretty much did, and he enjoys doing it with his family, which includes his wife and 2 children. So thank you so much for joining us today, Dr. Ochsner. I really appreciate it.
Thank you for having me. It's an honor to be on the show and it's great to see you.
Thanks. So it's the new year. A lot of people are starting to do that reset. Everybody has the New Year's resolutions. Most people with those resolutions are saying, well, I tell you what, I want to get healthier. And with getting healthier, that means activity and exercising more. But one of the things that you and I both see is that when people start exercising, then come the injuries. And it could be from a multitude of things. It could be technique, form, overuse, all of those things that we notice that people are starting to injure themselves. But before we talk about injuries, let's talk about prevention. So, what is a way for someone to prevent an injury before or while exercising?
I think injury prevention is a critical portion of avoiding a visit to come see me at its most elemental form. And so much has changed over the past 5 years where everyone can remember if you played high school sports, doing static stretching exercises, bending down, trying to touch your toes with your legs straight. And a lot of prevention on warming up before you exercise has moved away from that static prolonged stretch. And it's actually showing that if you go and hold for 3 seconds, then relax, hold for 3 seconds again, if we're talking about stretching your muscles, has actually been shown to be more beneficial. On top of that, what I would say is there is some data out there to suggest that whether or not you warm up before you exercise is controversial as to whether or not that actually can prevent an injury. But what we do know is that stretching after you exercise can definitely prevent an injury. So, if you're going to get on an exercise bike or go for a long walk or a run, it's the stretching after exercise that really makes a difference, less so than stretching beforehand. Now, if you haven't exercised, like a lot of times patients that I see when, it's the beginning new year, we've got some resolutions on the table. If you haven't exercised in a very long time, I always recommend doing a quick warm up with some stretching just to get your body warm, just because your body's not used to it.
So that's good to know because I know that that was one of the things I ran across this article and it was like to stretch or not to stretch. That's the question because the new information that was coming out. And then I'm just going to be honest because I tell everybody I like to share things about myself. And to me, and to I know some other people, you don't have to raise your hand, but sometimes stretching is boring. And it's like, really, I just want to get into the exercise. You want to get into the thing that you want to do. And so you say, oh, well, stretching is overrated. But I like the fact that you mentioned that we definitely need to do it after we exercise to just make sure that everything stays where it needs to be and then into that injury. And with those types of stretching, is it still the static stretching talk? I know there's your static stretching, you have your dynamic stretching. Does it matter which type of stretching that you do at the end of the workout?
I think dynamic has been shown to be a better stretch. But yeah, I think it's more so doing it than not doing it. It's easy to hop off the exercise bike or the treadmill. And a lot of times, if you're exercising in the morning, you've got a little stopwatch or clock that you're looking at because you got to get to work or, get the kids ready for school. So taking that extra 5 to 10 minutes to do the stretch, be it static or dynamic, is most important.
That's really good to know because I know some people say, okay, I'm gonna spend 30 minutes to work out, but in your 30 minutes, and if you know you only have 30 minutes, make sure in the 30 minutes that you've built in that 5 to 10 minutes to be able to do your stretching so that way you can prevent the injury. What the other thing that I like, you're very skilled when it comes to athletic related injuries. You have worked with several types of teams, such as the University of Memphis athletic teams, the Memphis Grizzlies basketball team, the Birmingham Barons baseball team, just to name a few. So, with all of those, like, what were some of the common and of course, I know that these are athletes that are performing like at their peak and they're in their prime, and we're talking about some people might just be getting started. Even with that, people who are exercising, who are getting out, doing the things, what are some of the most common injuries that you see?
That's a good question. I mean, I would say that those athletes that you were just mentioning, like you said, they are definitely at the peak performance level. And that's probably about 2 to 3% of the patient population that
Mm.
orthopedic sports medicine specialists take care of. the majority of people are your athletes of all ages, your weekend warriors, um, people who are just trying to be active, who like to play pickup sports on the weekends. I would say the most common injury that we see in sports medicine is a meniscus tear, um,
Mm.
which is an injury of the knee. We also see a lot of shoulder injuries. The rotator cuff, which is a muscle in the shoulder, is commonly injured in people between the age of 40 to 60. And then as you get older and you start to develop some arthritis, which a lot of people do sometimes in their early 40s to late 50s, but you most commonly see it in people in their 60s, 70s. A lot of times you start to see it's less of a overuse thing as it is you're waking up the arthritis in your knee, and that's what's causing you to have pain, or you're flaring up the arthritis. Um, but we see all sorts of injuries, and a lot of times we can get away with treating them conservatively, which is very important.
So let's talk about that because with that conservative thing, like I know meniscus tears, it just depends on what's going on. So let's just say someone goes out and they decide to jog and they haven't ever really done this before. And instead of doing something like a couch to 5K type of situation, they just say, I'm just going to run until I can't run anymore. And now their joints are aching, and specifically maybe a knee or something like that. Are there certain types of injuries that someone can try to treat at home? And if so, what are some of those things, like how long should they allow that to happen and take care of it at home before they see someone like you?
Absolutely. I do think that there are a lot of patients that I see that come in immediately after they get injured, where in the reality, or immediately after they start having pain, in reality, if you can ice whichever extremity, or if we're talking about a knee, ice your knee for 10 minutes, no more than 10 minutes at a time. There's a study that I read a couple years back that I've incorporated into my practice that shows there's really no benefit to icing an injured joint longer than 10 minutes. So some people have heard 20 minutes, 10 minutes. Um, Ice the extremity. And unless you have a serious injury where you feel a twist or a pop, I always recommend to try and move the joint. Not to the extreme that it's incredibly painful, but maintaining motion of an injured joint is very important. So just doing some gentle, bending and extending your knee are more beneficial than trying not to move it. Because the less you move a joint, the stiffer it gets, regardless of the injury. And then if you have some Advil or ibuprofen or a nonsteroidal anti-inflammatory medication at home, I typically recommend trying to take that. And usually, if people can take a medicine like ibuprofen a few times, twice a day, ice your knee for 10 minutes at a time, um, about 50 to 60% of the time, it gets better. And then if it still bothers you, then you should consider seeing myself or Dr. Booth for initial evaluation.
Okay, so they have done that, they've iced, they have rested, they have rested to the sense of they're not like over going back out trying to again. They are trying to do some of that at home. They're still moving joints. They've tried some of the non-steroidals and they say, I'm still having this pain. Ugh, okay, I guess I have to come in. So they come and see you because sometimes they'll come see me. But if they decide, okay, I need to go to ortho, perfectly fine. They come see you, but their thought process is he's surgery. So I'm going to have surgery because I've tried these things at home. What are some of the conservative things that you guys may try first? And again, everybody's situation is different. Some people can check that box for conservative. Some people, surgery is what you have to do. But those who qualify for some more conservative measures, what are some of those things? What does that look like?
Sure. So I think conservative treatment, the mainstay of conservative treatment for most injuries when you come to see me is if you've been taking an over the counter anti inflammatory. Sometimes I'll give you a prescription strength anti inflammatory that's a little bit stronger. Um, a lot of times I will get people involved with physical therapy. And you say to yourself, well, I can do exercises on my own. But physical therapy, I think, is very important because you are sometimes you may think you're doing an exercise correctly, but in reality, you're doing it absolutely incorrectly and could potentially be injuring yourself further. So doing it under the supervision of a physical therapist, I think, is very important. And beyond that, it's not just, them putting you into a corner and having you do 10 reps of a certain exercise. There's things what we call modality. There's laser therapy. There's cupping, which is basically where they apply suction to the shoulder. There's ultrasound, where they can use a anti-inflammatory gel to use the ultrasound to help penetrate the medicine deeper. So for conservative treatment, I employ physical therapy regularly. Almost everyone I see, I think, can benefit from it. And then lastly, if if you have a painful joint, a lot of times giving somebody a cortisone injection, which is a really strong anti-inflammatory, it's a steroid, can give people pretty quick relief. It's directly to the source. It decreases swelling, and usually people can, if they come in limping, a lot of times will walk out and with complete pain relief. So it's a nice fast option to get someone feeling better.
Listen, I feel like I need you to say it one more time for the people in the back about the physical therapy, because I get so many eye rolls from people
Mhm.
when I say, this injury, I do some imaging. It's okay. Everything looks intact. Everything seems okay. Let's go to physical therapy and strengthen these muscles, blah, blah, blah. And they're like, but I don't want to do that. Or they'll say, I've tried that. Or they're just going to give me exercises. I can do exercises at home. So I really appreciate you saying that physical therapy has a lot of benefits, and there's more to it than just exercising.
Absolutely. And it's not something that if you go one visit, you're going to feel better. It's usually I break it down into a 6-week treatment where you're going once to twice a week.
Mm.
And so if a full course of therapy is 12 visits, you may not feel better after visit 4, 5, or 6. It takes you there has to be some effort and accountability on the patient's end. And I tell people that on the front end. I was like, you get out of physical therapy what you put into it.
You're absolutely right. Like, I've seen some patients, the ones who actually commit and actually do it and go through with it are like, oh man, I feel so much better. Like, actually, we share a mutual patient, and they went and they said, oh my gosh, I did they got the cortisone shot, but then they also followed up with the physical therapy. And I was like, man, I feel like so much better. And I was like, that's great. And so it works. You just have to work with it. So I appreciate you saying that. Now, after patients have done the conservative measures, things are still not getting better. What is the next step from the ortho's perspective?
So if you have failed conservative treatment of a knee injury or shoulder injury across the board, I would say that at least 75 to 80% of people get better with a shot, with an anti-inflammatory, and with therapy. If you unfortunately are still having pain, then I think it's very reasonable to talk about what's called advanced imaging, and that's usually an MRI to take a closer look.
And once you do the imaging and you determine there's something going on here. I know that you treat like various parts of the body, and I want you to walk me through that. But at that point, when you see some abnormalities, they fail the conservative. Is that when you get to the next step of saying, okay, it does look like you would benefit from surgery?
Right. If there is any obvious abnormality on the MRI, like let's stick with the meniscus tear that we mentioned, that you have a meniscus
Hmm.
tear. You've tried to treat it conservatively. Then it's reasonable to talk surgery. And there are some situations out there where you you do have to jump the gun and not necessarily go down the route of physical therapy. But most of the time, you can try conservative treatment if you've exhausted it. Usually, you're a couple months into this and you're not loving life because it hurts, then surgery is a good option.
And then go ahead and let people know, because I know you talked about the meniscus tear, and I know there's a lot that you do, and we're trying to condense it down in this very short period of time. But because we're talking about like sports injuries, but you also do general ortho, just let them know the different areas of the body that you actually treat. So they'll know, okay, if I have this going on, this is who I should see. If I have this is who I can go to. So just walk them through the various parts that you treat.
Absolutely. I'm at Chatham. We're a multi-specialty group, but a lot of us treat multiple different body parts. From my fellowship training, I specialize in shoulder injuries, elbow injuries. I also work on the hip, the knee. Those are really the four main joints that I work with. If you injure your wrist or ankle, we have hand and foot and ankle specialists that manage that. If you have arthritis of those joints that I previously mentioned, the shoulder, hip, knee, elbow, then I also perform joint replacements on those joints as well.
Perfect. And now that you've kind of given us a great overview of what to do if we have these injuries, we can take care of them at home, when to come see you, some of the things that you can have them to do to get better. Any other additional tips that you have for people that are trying to get out there, they're trying to, stick to those goals, the New Year's resolutions. We don't want them to give up. We don't want them to injure themselves in the process of getting better. Anything else that you would like to say?
I do think, if you get out there and you try and go for a run or a walk and your joint swells or hurts, a lot of times that's a good indicator that you may have some arthritis. And so, what is
Mm.
arthritis? Arthritis is really the absence of healthy cartilage in the knee. It's not the presence of something bad; it's the absence of your normal joint surface. And cartilage doesn't have a lot of nerve fibers on it, but the underlying bone does. So as you wear down that cartilage, when you develop more arthritis, the bone swells, the bone hurts when it swells, and that's why arthritis hurts. So if you take a step back and avoid walking, because believe it or not, walking is a high impact activity, especially if you walk 3 or 4 miles.
Mhm.
I recommend my patients that do have arthritis that still want to get exercise to get on a stationary bike, to get on an elliptical, or to swim. And particularly water aerobics is a great
Mm.
exercise activity. So bike, elliptical, swimming are great ways to get good cardio and not upset the arthritis in your joints.
I love those tips because I just mentioned the water aerobics to a patient because she said, "Well, my joints ache and I just don't know where to go." Well, now you know, if you are watching, that the ortho also said it is okay to do the water aerobics. And I tell you, you'll get an awesome workout with water aerobics because, getting in there, moving those muscles, moving the water with it, but you don't feel all of the tension and the stress on the joints. So I appreciate all of those tips and how people can listen to their bodies. That's a really big tip, is listen to your bodies if this is what's happening. Because I heard this one quote that has always kind of made me say, And they said, well, pain is just weakness leaving the body. And I was like, okay, but pain could be an indication that something's wrong and maybe you shouldn't continue it. So, so I appreciate you saying that could be an indication of arthritis, but it doesn't mean it's an indication for you to give up. Here are some other alternative ways that you can still reach your goals and do what you want to do. So I really appreciate that. Thank you so much for joining us. Everyone, please follow Dr. Ochsner. He is at Chatham Orthopedics. And I know that he would love to see you guys if you're having any of your ortho issues. And like, if he can't fix it, they have a multi-specialty group. And so he has some partners and they're great people over there. They will be willing to help you and take care of you and get you back out and going and doing what you need to do. Thank you guys much for joining us on today. If you enjoyed this, make sure that you share, you like, you subscribe. I had some people that said, "Oh, I didn't know when you came on." So I said subscribe, and also turn on the notification bell, because then you will know when we go live and when things are happening, so you don't miss out. Again, thank you so much. We will continue to provide more things for you guys, and we will see you soon. Take care.